Hi, my name is Rebecca Gierdorf, and I'm going to be presenting my presentation on the pharmacological overview of metformin. So a quick overview of metformin. Metformin is considered the gold standard or the first-line oral medication for the management of type 2 diabetes. It works by lowering blood glucose levels and it increases insulin sensitivity. Pros of this medication are that it is extremely effective and very affordable. And not only is it used for type 2 diabetes, but it is also commonly used off-label in the treatment of prediabetes, PCOS, gestational diabetes, and weight gain. So moving on to the drug classification, metformin is in the drug class of biguanide anti-hyperglycemic agents. The U.S. FDA approved metformin for the management of type 2 diabetes in 1994, so this medication has been used for several years now. There are a few different brand names such as Glucophage and Glucophage XR, and then of course the generic name is metformin. All right, on to pharmacodynamics. So the cellular mechanism of metformin, so how does it work? It works through glucogenesis, which decreases the excessive production of glucose in the liver. It increases insulin sensitivity and it improves the peripheral glucose intake, along with decreasing the intestinal absorption of glucose. It also activates the AMP activated protein kinase, also known as the AMPK. And then the outcomes of these mechanisms, it lowers your fasting glucose, it lowers your HbA1c for almost to 1 to 1.5%, and there is no significant risk of hypoglycemia or hyperinsulinemia with this medication. Okay, now talking about pharmacokinetics. So how is this medication absorbed? It is absorbed from the small intestines. It is recommended that you eat when you take this medication to minimize the GI upset and side effects. The half-life of this medication is approximately 5 hours, and the bioavailability is about 50 to 60%. And then how is this medication metabolized? It is not metabolized in the liver, so it circulates unchanged throughout the body. Continuing on with the pharmacokinetics distribution, this medication is widely distributed into the body tissues such as the liver, the kidneys, and the GI tissues with minimal protein binding. And then it is excreted unchanged by the kidneys and it is eliminated through the glomerular filtration and active tubular secretion. Contraindications of this medication include severe renal dysfunction. So if the GFR is less than 30, the provider is not going to prescribe this medication. If you have any hepatic impairment, unstable heart failure, metabolic acidosis, those are all contraindicated as well with taking metformin. Of course, a hypersensitivity to metformin, and then also with metformin, if you're having any kind of procedure or surgery, you're going to want to discontinue your medication the day of, and then you can restart your medication once your GFR is stable and above 30. Common side effects of metformin are GI effects such as nausea, vomiting, and diarrhea. These effects can be minimized if you take your medication with a meal. Less common side effects are chest pain, headache, diaphoresis, weakness, and a prolonged use of metformin may cause vitamin D deficiency, but with monitoring, if your provider would notice that, we would just start you on a supplementation. And there's also a black box warning of lactic acidosis, which is very rare. It only occurs about 1 in 30,000 patients. And of course, you're at higher risk for this if you have hepatic or renal impairment, advanced age, alcoholism, or you take it while you're having surgery. So some special considerations of metformin. This drug is approved for patients over the over the age of 10 years old, as long as their GFR is over 30. Older patients should begin on a lower initial dose due to their decreased renal function. It can be used with gestational diabetes, but according to ACOG, insulin still remains the preferred choice. However, metformin can be used in certain cases. If you have patients on metformin, you should monitor their hydration and renal function regularly. If you start to notice a decline in either one, you should probably hold off on the medication. But dosage adjustments aren't necessary if the GFR is above 60. So, along with the effectiveness and safety profile of metformin, another huge benefit to this medication is how cost effective it is. It is a generic medication, so it is very affordable, which helps with medication adherence. It also helps with preventing further complications that would maybe cause hospitalizations or something like that. So it improves access to diabetes treatment and also improves long-term health outcomes. If I'm prescribing a patient on metformin, a few things I'm going to educate them on is to definitely take the medication with meals to prevent a GI upset, monitor blood glucose levels as we have discussed previously. You're going to want to avoid alcohol intake, especially significant alcohol intake while taking this medication. I really want to stress the importance of routine follow-ups and monitoring to monitor the GFR and fluid and electrolytes. And then I'm going to educate the patient to watch for symptoms of lactic acidosis and to report immediately to the healthcare provider if they start to experience any of those symptoms.